So there are a number of reasons women may seek a breast reduction, but broadly speaking, there are both functional and aesthetic reasons. So the functional reasons are due to the weight of the breasts. So the large, heavy breasts cause problems such as neck ache, shoulder ache, or backache. They can cause bra strap grooving, and also a lot of women can develop fungal infections under their breast, particularly in the warmer summer months. And from an aesthetic point of view, the breast reduction always involves a breast lift as well. So as well as a reduction in volume and size, the patient's also getting a lift. So the nipple's lifted, the breast is lifted, and the breast is tightened in effect. So it's a combination of a reduction and a lift. The typical scars for breast reduction surgery involve a scar around the areola and a scar vertically down, and most commonly also a scar in the breast crease. So effectively like an upside down T or inverted T, often referred to as an anchor pattern scar because of its resemblance to an anchor. There are times when we do the reduction without the transverse scar, circumvertical breast reduction, and this is something that tends to be reserved for people with slightly smaller breast reductions and maybe in younger patients whose skin is going to contract more predictably than people with slightly older, less elastic skin. So most typically it's the anchor pattern or inverted T pattern. Breast reduction is normally a general anaesthetic operation, or can be done with heavy sedation with local anaesthetic, and it's done in hospital. The nipple is lifted up, but unlike the myths that are out there, the nipple is very rarely taken off the body. It's actually kept attached to the breast, but just moved up within the breast. And the lower part or lower pole of the breast is usually removed, and the scars are along the breast crease and vertically up that close the defect effectively that's been left behind once a section of breast tissue has been removed. And then it's sewn together to form the scar around the areola, vertically down and in the crease. Recovery from breast reduction takes a few weeks. For the first 1 to 2 weeks, you need to take it fairly easy as the wounds are really healing. By 6 weeks, you should be able to get back to pretty well everything you'd like to do, going swimming, undertaking exercise. And really between that 2-week and 6-week period, so that 4-week block, you should gradually build up activity and build up exercise. But it's a false economy to do too much too soon. You really want to make sure your wounds are healed, your scars are settling down, and you've got the strength of your tissues intact before you undertake too much too soon. The main risks with breast reduction surgery are often the minor irritations, such as slight delays in wound healing, particularly if it's at the T-junction scar where the vertical scar meets the transverse scar. The risk, the most serious risk with breast reduction surgery is fortunately very rare, which is nipple death as a result of a failure of the blood supply to be adequate to the nipple. And that's either because of swelling, squashing the blood supply, or an inadvertent damage to the blood supply during surgery. Other risks can include infection and bleeding. If there's poor blood supply to the fat, that can cause fat necrosis, which can be something that presents as mild lumps through to an infection requiring further treatment. And inevitably, there will always be some asymmetries and differences between the breasts after breast reduction surgery, as there are in everyone in life anyway.